everyone, welcome back to Medico's Helpline. In this video, we'll discuss about external features of heart. Heart is a hollow muscular organ situated in the mediastinum of the thoracic cavity. It is enclosed within the mediastinum. It is pyramidal in shape, as you can see, and is placed obliquely behind the sternum. Okay, in this figure you can see it's behind the sternum and adjoining parts of the costal cartilages. A heart consists of 4 chambers, 2 atria and 2 ventricles. That is the right atria and the left atria, the right ventricle and the left ventricle. And when we see the heart shape, it is a pyramidal or conical in shape. The length is about 12 centimeters, whereas heart is having a width of 9 centimeters. Coming to the weight, in males, the heart weighs approximately 300 grams, whereas in females, it weighs approximately 250 grams. Here we come to the main important topic of the day, that is the external features of heart. We have the apex, base. Heart is having 3 surfaces, that is sternocostal, diaphragmatic and left surface, and 4 borders. The right and left border, the upper border and the inferior border. Coming to the apex of the heart. Unlike the name suggests, the apex of heart is not situated on the topmost portion of the heart. Instead, the apex is situated at the lowermost portion of the heart. In this figure, you can say this is the right side and this is the left side. The apex of the heart is a conical area which is formed by the left ventricle. This is the right ventricle and this is the left ventricle, and this particular portion, the topmost conical area, is called as the apex of the heart, and it is directed downwards, forwards and to the left side. Comparing it with the thoracic cavity, it lies at the level of the 5th left intercostal space. This is the 5th left intercostal space, and tracing it from the midline, it lies at the level of 9 centimeters or 3.5 inches, that is approximately here from the midline. Do you know that this portion is the apex of the heart, and we usually trace the apex beat at this point during auscultation? When we come to the base of the heart, it is just opposite to apex of the heart. If this is the apex of the heart, just opposite portion, this portion is called as the base of the heart. This is a posterior view of heart. Here you have the left atria and you have the right atria. So, the base or the posterior surface of the heart is formed by 2 atria, mainly by the left atrium. That is, the 2/3 portion of the base is made by, this portion is made by the left atrium, and just the 1/3 portion of the posterior surface is made by the right atrium. The surfaces of the heart. Heart is having 3 surfaces. One is the sternocostal surface, diaphragmatic surface and left surface. First, let us go to the sternocostal surface. In this figure, the ribs are removed. When we remove the ribs, the portion of the heart which lies in contact with the sternum, the costal cartilage, that is the anterior surface or the front portion of the heart, this whole portion is called as the sternocostal surface. Coming to the second surface, that is the diaphragmatic surface, the lowermost portion of the heart which lies in contact with the diaphragm, that is the lowermost portion or the inferior portion of the heart, is called as the diaphragmatic surface of the heart. Another surface, which is the left surface, which can be traced only in a 3-dimensional figure, is the left surface of the heart. As you know, the heart is having a conical shape or a pyramidal shape. Hence, it has got 3 surfaces. One is the front portion or the sternocostal surface. Another one is the diaphragmatic surface, and we also have the left surface. Heart is having four borders: the right and left border, inferior border, and the upper border. First, let us talk about the right border. The right border extends from the superior vena cava to the opening of inferior vena cava. It is a vertical line. This right border separates the base of the heart from the sternocostal surface. Next, we have the left border of the heart. This is a curved and oblique line, and it extends from the left atria to the apex of the heart, and it separates the sternocostal surface from the left surface of the heart. The third border of the heart is the inferior border of the heart. Inferior border is a horizontal line, and this extends from the opening of the inferior vena cava to the apex of the heart. This separates the sternocostal surface from the inferior surface or diaphragmatic surface of the heart. The fourth border is the upper border. This is slightly oblique, and this is mainly formed by the right atria and the left atria. In this video we learned about the external features of heart. We learned about the apex of the heart, the base, the surfaces and borders of heart. Thank you so much for watching. Subscribe to Mediquis Helpline for more videos, and do not forget to enable the bell icon for instant updates. Bye bye.